Ladies and gentlemen, please welcome the chairman of Brian's Wish, Gary Mendell.
Good afternoon, everyone. It is truly my privilege to be here today. I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative for bringing to the forefront these two important issues, mental health and addiction, which, as Dr. Satcher said, are so clearly related. There is so much I want you to know today about addiction. I could speak about the facts all day. But today, I'm here as a father. And I'll speak to you as a father. Because if you leave here today knowing just one thing, I'd like you to know about my son, Brian. Brian was, from the beginning, a very loving child and always cared about others. But he also struggled. He struggled with anxiety, and he struggled with ADD. He was the last to be picked for soccer, but he was the first to crawl under a fence at Yankee Stadium to give a homeless person a quarter, which he did when he was 8 years old. That was Brian. As a teenager, as many of our kids do, he tried marijuana. As his use escalated, his mother and I tried absolutely everything. Wilderness programs, therapeutic boarding schools, the best rehabs in the country. And Brian tried his hardest too. He even made it to college. But unfortunately, addiction is a harsh and unrelenting disease. Harder drugs followed, more relapses, more rehabs. From one program, Brian wrote me, "Dear Dad, I want you to know I am trying my absolute hardest to be a good son." To know Brian's character and the cruelty of addiction, I have to tell you what happened on October 20th, 2011, when Brian was 13 months clean. He spent the morning researching suicide notes. The first he read was Kurt Cobain's. Kurt was angry and bitter, but Brian was not. His note was about his sadness and tired resignation. And even in his last minutes, his thoughts were about others. "I don't want to hurt anyone anymore," he wrote. "Do anything illegal or get high. I thought sobriety was worth a shot, hoping to get back to normal life. But it hasn't worked. I love you all more than I can write." Then my Brian, the same Brian that at 9 months old, I remember playing peekaboo with him around our coffee table in the family room, and he would crawl around the table and look up at me with that smile of his. Then my Brian, he hung himself. He was 25 years old. I wish I could tell you that the anguish dulls with time, but it doesn't. It intensifies with me knowing that my son died of a disease that is preventable and we don't prevent, that is treatable but we don't treat, that is undeniable and we continually deny. A disease that in the time of this panel in 60 minutes will claim 15 more Brians in 60 minutes. A disease that today, while we're at this conference, 350 more Brians will die. And 350 more family members, 350 more families will be torn apart forever, as has my family. In the aftermath of Brian's death, I set out to learn what could be done to spare other families from this suffering. It's been a journey in darkness. Addiction works that way. It is shaded by stigma, family struggle, and isolation. For other diseases, there are research budgets, breakthroughs, and medications. For addiction, there is some research, but is not put into practice where it could have saved Brian's life and the life of so many others like him. For other diseases, there are national nonprofits like the American Cancer Society that provide a place for families to turn to for information, for support, and hope. For addiction, there is no such entity. That is Brian's story. That's my story. And if it were our story alone, it might end there. But it must not end there, because it is the story of 20 million Americans suffering every day with the disease of addiction, and 80 million family members who love them dearly. So for their sake, and as a pledge to the Clinton Health Matters Initiative, and in Brian's memory, I have made a promise. Enough. Enough. No more research ignored. No more Americans suffering alone, feeling ashamed because they have a disease. No more lives wasted. That is the promise of Brian's wish. Our new organization will launch later this year with a new name that reflects our national mission. We'll make a permanent and large-scale impact on this disease. The goal is simple: to cut in half the number of Americans who suffer from this disease, the number of Americans who die from this disease, and the cost to our society of this disease. The solutions are clear: prevention, treatment, recovery. We will provide resources to families. We will ensure parents know what puts their children at risk. We will move research off of scientific shelves into our communities where they belong. We will pressure policymakers for legislative changes that make common sense. And once and for all, we will eliminate the stigma of addiction. All this, I promise, as a parent who knows the anguish of bearing his child. These are promises whose ultimate success depends on all of us. Addiction requires a national commitment. Addiction requires a national voice. It claimed my son, Brian. It is not too late to save another parent's child. Thank you.